This video will discuss the side effects of medications and how it impacts our health. It's about time to take care of your health naturally.
You up front. Do you remember your calling? Because a calling is a reason for being. It's not just an opportunity, it's not just a job, it's not just something you're good at, and it's definitely not a passion project. The calling is purpose. Today we live in a world you didn't see coming. Med school didn't prepare you for this, and didn't. Remember who called you. Remember who gave you purpose. You see, that fire that burns within you is called hope. And hope shines its light in the darkness on the outside and dispels the darkness on the inside.
Hello and welcome. I'm your host, Ambassador Edward Portopro, CEO and founder of Shibaz Holistic Health and Services. If it is your first time on this channel, say don't relent, you are absolutely welcome. On this channel, we discuss a lot of things, but predominantly we discuss about natural health. How can one take care of your own health naturally? Your health is your wealth. Your health is your power. Your health is big time business. Why can't you invest in your own business by knowing how to take care of your own health naturally? Nobody is responsible for your health, neither the government, neither the pharmaceutical drugs industries, food industries, doctors, health workers. They're not responsible for your health. They only run your services to you. You are responsible for your own health. Understand that your health is no joke. It's no messing around when it comes to your health. This is a place that real people meet to be able to discuss and take responsibility of their own health naturally. When it comes to your health, you have to be radical. You have to be technical. You have to be realistic. And more, you have to be red. Because the risky part of the whole thing is this. If people around get to know that you are confused with your health, anybody will prescribe anything for you. Anybody will tell you anything. Even Pookie Ray will tell you something. He will give you prescription because you are confused. Do not allow yourself to get in that stage. If you want to know more about how to help yourself eliminate, detoxify, and clean some of the toxins that were being accumulated over the years from our medication, food, and drinks, do not relent. You are welcome to subscribe to
Every medication that you take will have some side effects. So let's look at those. Number one, regular old Tylenol. Tylenol is a good pain medicine. It doesn't work against inflammation like pain in joints. But for pain and headaches, sometimes it's a very good medication that you can use. If you use too much Tylenol, it can cause some liver disease. If you're using more alcohol than you should and you use Tylenol, it makes it a greater chance where you'll have serious liver disease. If you get liver disease, your eyes can turn yellow, your skin can itch, your skin turns yellow, your urine turns Coca-Cola colored. Be careful with Tylenol. Next is the NSAIDs. We've got aspirin and we've got ibuprofen. Let's talk about aspirin first. Aspirin's a great medicine. Not only does it work on pain, it works on inflammation. And so if you've got arthritis, aspirin is good for that. If you've got anything that's causing irritation of a joint, aspirin's very good. It works against inflammation, it works against pain. Side effects, it's really hard on the stomach. Some people can get GI bleeding with aspirin. Some people who are allergic that have nasal polyps and have asthma, they can have a severe allergy to aspirin. If you're younger than age 15, if you're a child, aspirin with fever, not a good medicine, or for pain, not a good medicine. There's a neurologic side effect called Reye's syndrome, so you stay away from aspirin if you're young. And then we get to the ibuprofen family. They're wonderful, they're good on pain, they're good against inflammation, they do a great job, but they also bother the stomach. So if you've got stomach problems, be very careful. If you use ibuprofen medicine and they work real good, be very careful about using them for too long a period of time, because if you do, they begin to bother and damage the kidneys. You can get high blood pressure from overuse of ibuprofen or Aleve or that family of medicines.
My name is Peter Gurje. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year, and half of these people die while they do what their doctors told them. So they die because of the side effects. The other half die because of errors. And it's often the doctors that make the errors, because any drug may come with 20, 30 or 40 warnings, contraindications, precautions, and so on. No doctor in the world knows about all this. So they give patients drugs that they should not have given them, that interact dangerously with other drugs or food items or so on. And then the patients die. That's the other half. So the other thing I found out 2 years ago was that much of what the drug industry does fulfills the criteria for organized crime in US law. And they behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries. So there's a huge amount of corruption. In my country, for example, Denmark, we are regarded as having very little corruption. But yet we have thousands of doctors on industry payroll, although we are just 20,000 doctors. So this is an effective kind of corruption. The drug industry buys the professors first, then chiefs of department, then other chief physicians, and so on. They don't buy junior doctors. So when several thousands are on industry payroll, it's really, really bad. And that's why I wrote my book, Deadly Medicines and Organized Crime, How Big Pharma Has Corrupted Healthcare. I hope to convince patients not to take so many drugs, because so many die from coming into your ward. And when you stop the drugs, I mean, that person becomes many years younger. You know, these drugs affect the brain, and old people tolerate that very, very badly. They fall, and when they break a hip, a quarter of them die. And for example, antidepressant drugs are used in more than 10% of our elderly. And they seem to kill 3% of them every year. I mean, if 100 old people take an antidepressant for 1 year, 3% of them will die because they fall and break their hip. This is a huge death rate. So a lot of other drugs than antidepressants also make people fall and kill. Very many elderly, they take more than 5 drugs a day, and we actually don't know how these drugs interact with each other, because it's not popular to tell the truth in healthcare. You will get a lot of enemies, because a lot of people make money on false premises, doctors and industry alike. And our drug regulators and our politicians, they are on board on this wagon.
Medication absorption is the movement of a drug from its site of administration into the blood. Oral drugs enter the stomach, where they either dissolve and pass through the cell membranes of epithelial cells lining the stomach, or travel undissolved through the stomach to the small intestine, which is the most common site of absorption. Here, drugs dissolve and pass through the intestinal wall. Oral drugs then travel through the portal venous system to the liver, where they undergo the first pass effect. During this process, the liver metabolizes some of the drug, either inactivating it or excreting it into bile for elimination from the body. The remaining amount of active drug leaves the liver and reaches general circulation and target organs. If a drug is administered via intravenous injection, it passes directly into the bloodstream, thus bypassing absorption in the GI tract. If administered through intramuscular or subcutaneous injection, The drug enters either muscle or subcutaneous tissue. Different drug formulations alter bioavailability because they are not absorbed at the same rate or to the same extent. For example, tablets dissolve at varying rates. Enteric-coated drugs dissolve in the small intestine, not the stomach. Because gastric emptying time differs between individuals, absorption times also vary. Sustained release formulas contain tiny spheres that dissolve at different rates, resulting in a steady drug release throughout the day, but also resulting in variable absorption.
These three people is doing something risky. Is it the one who takes their cholesterol medication with grapefruit juice? The one who takes acetaminophen pain relievers for a sore ankle before going out for drinks? Or the one who's on a blood-thinning medication and takes an aspirin for a headache? Actually, all of them are. Each has inadvertently created a drug interaction that could, in extreme cases, lead to kidney failure, liver damage, or internal bleeding. Drug interactions happen when a combination of a drug with another substance causes different effects than either would individually. Foods, herbal supplements, legal drugs, and illicit substances can all cause drug interactions. Most drug interactions fall into two categories. Some take place when two substances' effects influence each other directly. In other cases, one substance affects how the body processes another, like how it is absorbed, metabolized, or transported around the body. Blood thinners and aspirin, for example, have similar effects that become dangerous when combined. Both prevent blood clots from forming. Blood thinners by preventing the formation of the clotting factors that hold clots together, and aspirin by preventing blood cells from clumping into groups that become clots. Individually, these effects are usually safe, but taken together, they can prevent blood clotting to a dangerous extent, possibly causing internal bleeding.
Older people who take a group of drugs used to treat conditions including asthma, depression, and epilepsy may have an increased risk of dementia and even death. That's according to new research. Our health correspondent Adam Brimelow reports.
There's an increased risk of brain dysfunction and memory loss if you take these drugs for a period. And we've also found that there's an increased risk of mortality associated with taking these particular medications.
We have our medical director, Dr. Paul O, and he's going to be talking to us about...
Thank you, Rob, and thank you all of you. How does cannabis cross over with respect to the heart? Okay, there are many places where we could go to around pain and the brain and other places. That would be subjects for other talks. But for today, we're going to focus on what's going on with the heart and this new phenomenon of cannabis. Some of you may know that some of my training after I did my medical school was in the area of pharmacology or clinical pharmacology. That's how drugs and medicines interact with the body. The pharmacology, what happens when substances from cannabis get into us? What about some of the evidence for or against? Is it perfectly safe for the heart? I'm going to kind of lead you on and say, well, maybe there are some effects on the heart that we should be aware of, but nobody really talks about it. And it may actually help with nausea. This is why some people with cancer on chemotherapy may be using a marijuana cigarette to control the nausea, because it can actually help by interacting with those receptors. And this is the stuff where people are really wondering, are there really some good medical effects? That we don't have really great research about this yet, but there is a growing body of literature that talks about how some people might be using products with a lot of CBD to help with pain, for instance, or to control seizures or other neurologic conditions, or inflammation in the body. All right, so I'm not pushing anybody to say you should be running out and getting this, but this is why there is a lot of interest. The other thing is that it matters a lot on how you use the substance, right? So when we say cannabis, we often think, well, it's all the same plant and people smoke it, don't they? Well, you actually get some of that stuff and you smoke it. The advantage of that, and maybe some of the danger of it, is that you burn it, it gets into your lungs and gets taken up into the bloodstream very, very rapidly. It gets up into the brain very, very rapidly. So if you're looking for something to change the chemistry in your head, this is the most rapid way of doing so. But just be aware of those kinds of problems, right? The other thing is that if you burn stuff, burning is not a good thing. Inhaling smoke, I'm afraid, is not a good thing. That the byproducts of burning stuff is lots of chemicals that you probably don't want in your body. They don't belong there. And just like burning a cigarette is a bad thing for you, burning a marijuana cigarette is also probably bad for you. And I did this chat last week at a cardiac conference, and I challenged the group to say, do the medical practitioners know enough? And I think the consensus is, at least from the medical side, we don't know enough about this. So this is one of the concerns that's currently out there. So we all need to have a more informed discussion. We need more awareness about what these products mean, and cannabis is not cannabis is not cannabis, that there's a lot of subtleties underneath there. And my question for the next little while, is it safe for the heart? Just because they say there's lots of good things that could happen, should we be not only aware what the products are, because that's complex, but what might happen to the heart? You with me?
Wondering about its effects on the brain and body. When a person smokes cannabis, THC and CBD go into the lungs and to the bloodstream. Once the chemicals are in the bloodstream, it is transported throughout the body, though the after effects of drugs are experienced at different intensities. General effects include increased appetite for food, laughter and joy, and the ability to hear, see, smell, taste, and feel drastically increases. Focusing on the short-term effects of cannabis on the brain, cannabis creates tiredness, difficulty in remembering information, concentrating, and confusion. It can also lead to anxiety, fear, and reduce the ability of a person to react quickly, thus making it dangerous to drive or operate equipment. Short-term effects also include psychotic episodes, including paranoia, delusion, or even hallucinations. However, the long-term effects of cannabis use are severe. The ability for the brain to remember information, concentrate, make decisions can significantly decrease, as well as the overall IQ. These effects can be permanent even after cannabis is stopped, and can be experienced differently depending on the person, especially on age. Now that we know about the effects of cannabis on the brain, let's dive into its effects on the body. In the short term, cannabis damages blood vessels, decreases blood pressure, and increases heart rate. These can further cause the person to faint, become prone to heart conditions, or get a heart attack. If a person continues to smoke cannabis, in the long term, they can experience problems with their lungs. This can increase their risk of bronchitis, lung infections, chronic cough, or increased buildup of mucus in the throat. One question that often comes to mind when thinking about cannabis usage is, how does frequent marijuana use increase the development of mental disorders, such as psychosis, schizophrenia, depression, and bipolar disorder? And is there even a link between cannabis and these mental health illnesses? Maternal cannabis use, or using cannabis while pregnant, may also contribute to psychosis in the child during later stages of their life. That cannabis causes anxiety.
Questions at the back of the room. He will also be collecting the evaluations, and I have a question. I heard about this on that side from, this is going to be, but this is the first time I'm hearing about the consequences of it. And there's always these, written panels about, okay, just fill out your name here and we'll fill out the rest. Is there anything that other people in our communities?
For giving us your attention, engaging with us, asking the questions that you did.
The calling is purpose, and bigger than you. Remember who called you.
It's about time to take care of your health naturally.
I want Liberian no star, one of four players. I want Liberian no star, got one of four players. I want Liberian people, we choose success. I want Liberian people, we choose success. Yeah. Liberian people, we you